hydrocephalus. There are other ways to look at imaging in the brain, and one of those is demonstrate how the brain supply, the blood supply increases when you are, for instance, moving a thumb. The contralateral area of the brain will increase the amount of blood flow since your neurons are firing more frequently in response to this. And you can actually see that in action, showing how the different sections of the brain, in the top, this one is on the frontal view, and then you can see it on the side of the brain. So these are tests that allow you to see how is the connectivity of the brain. In general, the CT and the MRI can give you only sort of the topographical view, how is the structure, what are the maps of the brain, and correlate quite well. If you do the section through here, you can see large empty spaces where there has been thinning and loss of gray matter in the brain. For instance, in some patients who have another form of dementia that is relatively common, the frontotemporal dementias, where the lesions involve the frontal part of the brain, you can see how there are deep valleys in there that have nothing to do with the rest of the brain, where there's normal architecture. So the job is to try to find out if the patient comes with a diagnosis of Alzheimer's disease and even with appropriate treatment, but in the absence of a true marker of the disease, we don't have a blood test. We're beginning to have a marker for amyloid deposition, but as you saw, some patients have a lot of amyloid and don't have dementia, and other patients have a lot of dementia and little amyloid. So what are other options that could be confused, that could be diagnosed incorrectly as having Alzheimer's disease? Is there any hope for treatment? Well, there are several conditions, and one of the most common ones is normal pressure, hydrocephalus. In that case, the water, the cerebrospinal fluid inside the ventricles that I show you, gets too big and it pushes the brain out, so to speak, and decreases the amount of blood flow and produces a distortion of the brain because of the pressure inside the brain. And that is treatable essentially with a shunt to lower the pressure. I mentioned severe obstructive sleep apnea, and the question to ask is, do you snore? You have to ask it to the spouse, of course. There are cases of something that you probably heard called Hashimoto thyroiditis. This is a very common cause of goiter, enlargement of the thyroid gland that is seen especially in adolescent girls for some reason. It's increasing in frequency for reasons that are not very clear, and it usually stays in the thyroid. It tends to produce an inflammation that may be treated with thyroid hormone replacement. But sometimes we find that the TPO, the thyroid peroxidase antibodies, affect the brain. And these patients present with a clinical picture that resembles very much a rapidly progressive form of Alzheimer's disease. The good news is that it responds very well to treatment with essentially steroids treatment. There are other conditions. The original case is described with a teratoma. The teratoma is a tumor that sometimes develops in the ovary of women in reproductive age, and it has all three layers of the original embryo. So you can find teeth, you can find hair in the tumor, there is muscle, there is tissue from the intestine, and there are also components of brain tissue. So this is sort of an abnormal brain tissue that is present there, and there is a receptor called NMDA that begins to agitate the immune system so that your own defenses attack this tumor and also attack the brain, because the brain, of course, has a large component of this excitatory receptor. And the patient will present with seizures, with coma, and they will die in most cases unless the diagnosis is made, and with a small surgery nowadays for removal of the tumor, there is complete healing of that. So it's not too common that we see that, but when you diagnose it and treat it correctly, it's life-saving. There is a large group of what we call the iatrogenic dementia. That's a Latin name for something that means the doctor made a mistake. So, these are patients who are taking medication for other reasons. The patient may be taking valproic acid as a mood stabilizer or for the treatment of migraines. It's a correct indication, of course, but sometimes, especially in elderly patients, it can produce a clinical picture of deafness and dementia, progressive dementia. Fortunately, if you stop it, the dementia gets better. The benzos, which are tranquilizers of the family of lithium and Valium and so on, also have as a side effect loss of memory. And some of the early sleeping pills that people used to take on the transatlantic trips, where they wanted to sleep in the plane and then get presented a lecture in Europe, some of them sleep, wake up, and they don't know what they are doing in Barcelona. So it's a big problem because these benzos block the receptors for memory. So people who cannot sleep without taking sleeping pills or taking tranquilizers and then complain of memory, you better start there. Although it's not easy to get them off some of those, for instance, Xanax is a famous one. It's extremely difficult to eliminate. Patients who are taking anticholinergics, either the family of these are old antidepressants, some of those, such as Mipramine, are used also for the prevention of migraine headaches, but they block the chemical messenger that is responsible for memory, called acetylcholine. So if you block the acetylcholine, the memory is going to be bad. So it's a good idea to eliminate those. And the numbers are very large. Some of the antihistamines, the medications that are used for bladder control. Sometimes we find that the patients who are diagnosed with Alzheimer's and then they are told that the problem is that they have a prostate and they have alterations and they are incontinent of urine. Actually, what is happening is that the brain has lost control of the bladder. But if they are taking a number of those medications to control the bladder, then that may affect the amount of acetylcholine in the brain. So the antipsychotics, the muscle relaxants, you may recognize some of those names, Soma, Flexeril, agents to control increased bowel movements, anti-diarrhea, the opioids, and meperidine are also sources of potential worsening of the dementia or memory problem. Pernicious anemia used to be very common because some of you may remember that the treatment was discovered in Boston and it consisted in giving the patients large amounts of liver. So that became kind of the source of cobalamin and vitamin B12. And we now find very often that patients who have difficulty with absorption of vitamin B12, some of the things that block the absorption of B12 include the use of the purple pill and other of those medications that block the acid in the stomach, can produce difficulty with the absorption of B12. The use of some of the medications for diabetes also can do the same. The infection in the stomach with the bacteria called H. pylori, HP, can produce atrophy of the stomach, can produce ulcers, and it blocks the absorption of B12. And the problem is that lack of vitamin B12 increases the concentration of an amino acid in the blood that has a damaging effect on the circulation. So it's a good idea to make sure that the patients have appropriate levels of vitamin B12 and folic acid also to lower the effects of this lack of the vitamin. Among the other agents, we rarely see gluten encephalopathy. Patients who are allergic to gluten in bread will develop encephalopathy also because of this. So in general, the most common one of the agents that we see is this dilatation of the ventricles that can be solved with the insertion of the shunt that will solve and cure in some cases these problems of dementia that are incorrectly called Alzheimer's disease. So the final message is that even if you have been told that the diagnosis is Alzheimer's disease, there is always hope. So any of the three in the group will be able to walk you through the correct differential diagnosis. And if you are lucky, then we can help in slowing the progression or even curing some of those manifestations. So many thanks for your attention.